Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon, and I specialize in facial rejuvenation, basically helping people look as young as they feel. And this entire YouTube channel is about education, knowledge, and empowerment so you as the viewer can understand not only how the aging process occurs, but also what are the best treatments available to help defy it. Today is a really special treat. The video that we're going to show today is basically the first step along the journey of facial rejuvenation, which starts at the consultation. I had a beautiful patient of mine from the Las Vegas area who decided that she wanted to share her entire journey. We met the day before her surgery and had a pre-operative consultation, and I kind of took you guys through the entire evaluation, the considerations, what each of the procedures in a full facial rejuvenation does, and at the end we get a much better idea of what you can assess in yourself and also the type of outcomes you can expect from these different procedures. This will help you stay on track, help you understand what eventually will need to be done, and ultimately give you good knowledge and information as you travel through this road towards anti-aging and facial rejuvenation. All right, so without further ado, check this out. All right, so we are here with Gina. Gina came in from Las Vegas. We actually had a pre-operative meeting. Her surgery's tomorrow, and I literally just happened to ask her if she'd be cool with sharing her journey, and I was so happy to hear that she is. So we said, why not take the entire sort of pre-operative consultation process and film it. So Gina, you're 50 years old.
Yeah.
When did you start thinking about this and considering this?
Probably seriously about a year ago.
About a year. Is that when you started noticing the changes, or when you started?
No, I started noticing the changes probably about 3 years ago.
Mm-hmm.
But I was afraid to do it too early and then have to redo it again in 10, 15 years or so. So I kept pushing it off. And then that big number 50 came up, and I was like, you know what? I owe it to myself. I don't feel 50 inside.
Yeah.
I look 50 on the outside, and I want to match the inside.
Is that? I mean, you see the stuff that I write, the captions that are always like, "Look as young as you feel." This is about. That's really at the end of the day what it's about, right? I mean, I don't think that there's ever been an exception where somebody comes in here for any other reason, but it is hard to see your face sort of, changing, slipping away, like your identity is not exactly matching up, and then to think that you're 50 and you've got all these years ahead of you, these decades ahead of you, God willing, and then all of a sudden the prospect of this change just progressing further and further becomes very daunting and challenging to accept.
Right, and I don't want to go from super wrinkled to so tight either. I don't want it to be a severe dramatic change. I want to do it when it's not so severe and dramatic.
That makes a lot of sense. I mean, that's when I would say the average time when people start noticing these changes are right around 47 for most people. If you were kind of like, and then typically by the time, like you said, you kind of get around to it, do your research, figure things out, feel comfortable with the surgeon. Sometimes it takes a few years, and sometimes it takes longer. It just depends.
Right.
Okay, so let's kind of go through the game plan, and I'll take you guys through the rationale for each thing. So tomorrow we're going to do a vertical restore. We're going to do a fat transfer. We're going to do an upper eyelid blepharoplasty and a lower eyelid blepharoplasty and a lip lift. So fundamentally, all of that stuff together fits under the category of full facial rejuvenation, because the way to keep things looking natural, and this is a great opportunity to kind of show this, is you recognize that every one of those things has a particular area that it's treating. Upper eyelid blepharoplasty is the eyelid, lip lift is the lip, the lip, the vertical restore is this. But you'll notice, when you're older, all of them are aging. When you're younger, all of them are younger looking, right? It's not a mix. It's not a mix between like eyelids look great, jawline doesn't. Like that's usually all of it's affecting. So one of the keys to keeping people looking normal and natural, and this has been kind of my 15+ year philosophy, and it's never let us down, is that putting it all together is equally as important as the techniques involved in how you do each one of those procedures, you know, in terms of ending up with a very natural looking outcome. Okay, so let's take a look at the big one, which is the vertical restore. So the changes that happen with age is the corners of the brow come down a little bit, the mid-face comes down, and you can see how the mid-face has a little bit of a cleavage here, and then the nasolabial fold area is getting a little bit heavier right there. And then as it comes down, you can see the jowls start to set in along the jawline, and then fundamentally at the end, you get some thickening of the neck and the loss of that you know, sharp angle in the neck area. And so when you look at in the front view, here, what happens is there is a squaring effect of the jawline. Is that something you've noticed?
Yes.
Like things get a little square. So the vertical restore is really this. It's about bringing all of this back up, and look how bright and beautiful that the shape of the jawline becomes. And then the big difference with vertical restore versus anything else is, again, we're going vertically like this, so we end up with this bunching right here, and then what we're going to do is elevate all this tissue at the same time. Look how pretty that looks when it all comes up together. So essentially we're treating this area, this area, this area, and this area as one unit. And then in the neck, I'm going to come in here, I'm going to take out the fat pad out of here, so that'll give us a nice opportunity to get nice and flat throughout this region. So that's the foundation of the face. That's what's going to give us the overall improvement in shape. Then if we think about all this fascia as getting longer with age, the same thing is happening to the fascia of the eyelids and the lip. So we said that the ideal distance of a lip is around 13 to 15 millimeters. And as we look here, we are around 18, 19 millimeters, right? So what we're gonna do, and go ahead and open your mouth slightly for me, so you can see here, and a little bit more, so you can see, you can't really see the tops of the teeth. Why that's important is because in a youthful lip, you can see the bottoms of the teeth. I should say the bottoms of the top teeth is what you cannot see right now. With a little bit of eversion, you can see those, and that's a much more youthful shape right there. So that's going to shorten up just a little bit, nothing too dramatic. Probably 4 millimeters or so we're going to remove. And then as far as the lower eyelids go, you can see there's quite a bit of extra stuff here. This is all stuff that doesn't need to be here. So we're going to remove all of this out of here. That's a big move, and that's going to make a huge improvement on the lower eyelid. And go ahead and close for me. And then the upper eyelid is all this extra skin here. So the combination of removing skin here and removing the soft tissue here, lifting all this back up, giving this a little bit of a gentle upward redirect, is going to be an amazing, amazing outcome. And I'm so excited for you. And thank you again for allowing us to do this, because I think this was one of the first times I've actually had an opportunity to go through the entire pre-consultation process. And I think it'll give everyone a little bit better idea of what each particular procedure is designed to treat.
Yeah, I'm excited, super excited.
Yeah, absolutely. Oh, and just an FYI, and I always forget to mention this, but the procedures are done under local anesthesia with IV sedation. For a lot of people, that's like
that was huge for me. Huge in making the decision, because I do not come out of anesthesia very well. And I think it's just one less thing I have to worry about.
Absolutely, and it becomes a surgery of the soft tissues of the face as opposed to the things that can go wrong with anesthesia,
right,
which is a game changer in terms of safety.
Right.
So that's really great. Well, anyways, thanks again, and we're going to take care of you tomorrow morning.
See you tomorrow.
All right.
Thank you.
All right, everyone. So I hope you enjoyed that consultation process. That is basically the thought process that I have as I go through every single consultation and pre-consultation process. I'm thinking in terms of holistic. I'm thinking in terms of how these different parts of the face will relate to one another. And as you can see, the vertical restore, which is the technique that I developed and I trademarked, is the procedure that is fundamentally responsible for the restoration of the facial shape, that V-shaped jawline, that smooth neck, that lifted midface and lifted lateral brow, and that is the foundation of the face. And I would just want to emphasize again, if you are in that age range where your face is starting to sag, using other types of treatments before you have something like the vertical restore simply isn't going to work. Not only is it going to end up looking sort of half-baked or unimpressive, but it also leave you feeling a little bit, gypped if you're going after different types of thread lifting, different types of energy-based devices, the use of fillers, and I have a bunch of videos on exactly that topic. You can stay online here and watch those videos where I talk about the shortcomings of those procedures when it comes to facial rejuvenation and some of the things to consider when it comes to non-surgical treatments in terms of how they can be helpful, but also the areas where they don't quite meet the mark. So once again, it was a pleasure to have the opportunity with Gina. So grateful for her to be able to share this with all of you. And stay tuned, because as we speak and as this video is going live, she is going through the recovery process, and she's been cataloging every single day of her recovery. And we're going to put together a beautiful journey video that takes her through the entire process, which will air very soon, as soon as she gets healed up. So I know many of you are waiting to see how she turns out and how she looks. I promise you it's going to be amazing. We just have to wait till she heals. So stay tuned, keep your eye out, it'll be there. If you haven't already, subscribe to this channel. We've got tons and tons of great content on everything related to facial rejuvenation, bringing honest and authentic information your way. Share it with your friends, your family, and anyone who you think might enjoy this, so we can spread the good word. Comment with any questions that you have. I'll be happy to answer them as quickly as I possibly can. All right, guys, thanks again. It was my pleasure. Stay tuned for more videos like this.